Health promotion and maintenance questions, they're sneaky. They won't always say developmental, milestone, or vaccination. Instead, they'll drop a question like a 15-month-year-old is not being able to walk, and boom, testing your growth and developmental knowledge. Most students miss it because they think that it's prioritization based question, but it's not. That's why knowing your milestones can literally save you in the exam. Don't let it trick you. Prep smart. Hey, beautiful people. Welcome back to another episode of NCLEX-RN Prep. And if you're new to this series, I'm Mona Lisa, a US RN. Formerly, I was a UK RN as well as Indian RN. But most importantly, I'm your NCLEX buddy who will help you crush this exam with confidence. Yes, if you haven't watched the previous episodes, then what are you waiting for? Go check it out. But before we dive in, a big shout out to Tony Joseph, who correctly answered the challenge question from the last episode. As we all know, physiological adaptation is one of the most important topics on NCLEX-RN, and I'm so happy that so many of you have responded well. Let's check it out. Here's the question for you. What do you do if a chest tube gets accidentally pulled out? A. Cover the site completely with an occlusive dressing. B. Tape a sterile dressing on 3 sides. C. Place the client in a prone position. And D. Clamp the chest tube immediately. And the correct answer is, of course, B. Taping on 3 sides create a flutter valve to prevent a tension pneumothorax. And as promised, here's the new episode, and this one's a gold mine. Because health promotion and maintenance shows up across every stages of life in NCLEX-RN. From babies to teens, pregnancy to postpartum, everything is all in here. Do you know that according to NCSBN, this topic covers about 6 to 12% of this exam? But most students actually find this context hidden between bigger clinical questions, and we are here to decode that. Now this part is hot on NCLEX. You must know what's normal in all stages. Yes, it's very important for all those select all that apply questions and priority based questions. I know you're all trained nurses and these topics are not new to you, but let's just discuss about each and every milestone briefly. Let's break down developmental milestones in a way that sticks. At 2 months, babies start to smile, coo, and lift their heads. By 6 months, they roll over, sit with support, and babble. At 9 months, they pull to stand and develop a pincer grasp. By 12 months, they say simple words like mama, papa, dada, and may take their first steps. At 18 months, toddlers walk well, throws balls, and say around 10 to 20 words. By 2 years, they start forming 2-word phrases and can climb stairs. At 3 years, they ride tricycles, speak in full sentences, and copy a circle. Remember, milestones build from head to toe. First head control, then sitting, standing, and walking. As kids enter the school age years from 6 to 12, it's all about refining motor skills and developing peer relationships. They become more independent, enjoy team games, and start to follow rules seriously. Cognitive skills grow fast, they understand logic, time, and can solve problems. Think, reading, math, and friendships. Now, in adolescence, from 12 to 18 years, it's a time of rapid physical, emotional, and social changes. Puberty hits, abstract thinking develops, and identity becomes a big focus. They may challenge authority and seek peer approval. It's all part of the growth.
Now, the NCLEX tip for this is always expect questions that focus on safety, mental health, and risk behaviors like substance use or sexual health during adolescence.
Now, the NCLEX hack for this topic is always and always focus on the gross motor development first, and then go to the fine motor skills, and then go to the language skills. Do you get my point? No? For example, if a child loses a skill, that's a red flag. Yes, it is. Still don't get it? Let's just try with a practice question.
Let's practice with a question. A 9-month-old infant is brought in for a checkup. Which of the following behaviors is developmentally appropriate? A. Walks unassisted. B. Uses a pincer grasp. C. Says 2 to 3 word sentences. And D. Copies a square. Now you know the drill. You have to pause the video, think about the question wisely, and when you're sure about your answer, resume it. And the correct answer is B. Uses a pincer grasp. As we all know that a 9-month-old infant cannot walk unassisted and can neither say 2 to 3 word sentences, and just forget about copying a square. So yeah, the answer is B. Well done, guys.
Now, prenatal care questions are all about anticipation and education. You'll be asked what to teach, what to educate, what to intervene, how to find out the problems, the causes, and yes, it's all about health education. Here are some key topics to know.
Prenatal care starts even before conception with folic acid supplements to prevent neural tube defects. Routine visits check mom's vitals, fetal heart tones, fundal height, and monitor for early warning signs. Ultrasounds and lab tests are done to screen for infections, gestational diabetes, and anemia. Now, let's talk about high risk pregnancy conditions you must know for NCLEX exam. Isn't it very simple? Just remember this: Lara Croft. Screenshot it or just note it down because this is very, very important. Trust me, it did help me a lot. These are most commonly tested topics of high risk conditions like pregnancy conditions in NCLEX-RN exam.
Now, as usual, let's just practice another question.
Which of the following findings should the nurse report immediately in a pregnant woman at 32 weeks gestation? A. Mild backache. B. Occasional fetal movements. C. Epigastric pain and headache. D. Ankle swelling by evening. Now pause and come back to me when you're ready. Yes, you're right. The correct answer is C. Epigastric pain and headache. It is a sign of preeclampsia. Well done, guys.
Now, the NCLEX hack is when the question asks you about what is the most important teaching, then you should think that it's all about safety and immediate risk. Always think about what can harm a mom, like a pregnant mother or a delivering mother or a postpartum mother or the baby. And then you'll get your answer.
Vaccination schedules can feel overwhelming, but NCLEX loves to test them, especially the timing and contraindications. But don't worry, I'll break it down into what you really need to know. At birth, babies get their first hepatitis B shot. Then comes 2, 4, and 6-month vaccines. This is your high yield group. DTaP like diphtheria, tetanus, and pertussis. IPV like inactivated polio. HIV, Haemophilus influenza type B. PCV, pneumococcal virus, and rotavirus, which is an oral vaccine. Watch for contraindications like intussusception. At 12 to 15 months, it's time for MMR, measles, mumps, rubella, a live vaccine, then varicella, which is also a live vaccine, hepatitis A, 2 doses and 6 months apart, plus boosters for HIV and PCV. At 4 to 6 years, give booster doses of DTaP, IPV, MMR, and varicella. At 11 to 12 years of age, give Tdap booster, HPV vaccine 2 to 3 doses depending on age, and meningococcal vaccine. Then again at 16 to 18 years, a second dose of meningococcal immunization.
Okay, so this is one of the most tested topics in pediatric and safety questions. But our goal is to economize the time, right? So we'll just discuss about the core facts.
Some vaccines have specific contraindications, but all vaccines may present these general contraindications. If a patient experiences a severe allergic reaction following vaccination, that means they cannot get that specific vaccination again. Note that children can still get vaccinations even if they have a low grade fever or minor illnesses like a cough, a cold, or an ear infection. It is no longer best practice to skip a vaccination appointment for this sort of low grade infection or illness. Both the hepatitis B and HPV vaccines are contraindicated for patients with a hypersensitivity to yeast. The DTaP and Tdap vaccines are contraindicated for people with neurologic disorders like epilepsy, whereas the rotavirus vaccine is contraindicated for patients with a history of intussusception, which is a medical emergency involving obstruction of the intestine. The polio vaccine is contraindicated for patients with a streptomycin, an antibiotic, and the first drug to be successful against tuberculosis. Its toxic side effects mean it is only used with other drugs. Polymyxin B, an antibiotic, or neomycin, an antibiotic related to streptomycin allergy. Since MMR is a live vaccine, it is contraindicated for children under 12 months of age. Whereas varicella, like MMR, is a live vaccine, so it is contraindicated for young children under 12 months. And similar, the MMR vaccine, the varicella vaccine is contraindicated for patients with immunodeficiency, patients who are pregnant, or anyone with a neomycin or gelatin allergy.
Are you ready for another question?
Okay, so let's do this quickly. Which of the following vaccines should be delayed in a 5-month-old infant with mild fever? A. Hepatitis B. B. DTaP vaccine. C. Rotavirus vaccine. And D. None. Pause the video, think about the answer, and come back to me when you're ready. Of course, the correct answer is D. None. Mild illness is not a contraindication.
Now, before moving to the next segment, I have something to say. Well, I'm so happy with all your comments, your support, your likes, your shares, your messages, your DMs on my Instagram, on my Facebook. I can't even thank you enough. And I know this is too much for you to take in between, but I really wanted to appreciate this moment that I have you guys around me, with me, supporting me all the time for so many years. And this is so much, this is absolutely boosting my energy. And I'm so happy and thankful to all of you. Thank you so much. And I'm so happy that I could help you guys with the Mark K lectures and the notes, the blue book and the yellow book. Also, I have one more question for you all. Are you guys enjoying this series? Because honestly, I did not get any feedback as of yet, like proper feedback from all of you, whether you are enjoying this series or not. If you are not enjoying this series, you can tell me, you can comment below, and I'll stop. I'll stop posting this series and I'll think of some other ideas. Obviously, I'll take all your suggestions and guidances. So this means a lot. But please do comment. Now, without wasting any time, let's just move to the next segment. Now, newborn questions normally test your ability to distinguish between what is normal and what is abnormal and to act fast when needed. You have definitely heard about Apgar scoring, right? Let's just brush up that again.
Let's talk about one of the first things we assess right after a baby is born, the Apgar score. It's done at 1 minute and 5 minutes after birth and sometimes again at 10 minutes if needed. Apgar stands for appearance, pulse, grimace, activity, and respirations. Each category is scored from 0 to 2. A perfect score is 10, but most babies score between 7 and 9. That's totally normal. Here's a quick breakdown. Heart rate over 100, that's a 2. Crying strongly, that's a 2 for respirations. Active movement, pink all over, strong reflexes, full marks. A score of 7 to 10 means the baby is adjusting well. 4 to 6, some interventions may be needed. Below 4, immediate resuscitation is likely. Now, the NCLEX tip for this is always know when to stimulate, suction, or begin CPR. The Apgar score guides you. In newborn care, also remember thermoregulation, cord care, vitamin K injection, and eye prophylaxis are essentials right after birth.
So this was all about Apgar scoring. Now let's discuss about some other important topics in neonatology.
Let's wrap up this newborn care segment by covering some other high yield topics you can't skip for NCLEX. First, immediate newborn care after birth. Within the first hour of life, we follow the warm, clear, stimulate rule. Warm the baby, clear the airway, stimulate breathing. Also, administer vitamin K, erythromycin eye ointment, and assess Apgar scores. There are some newborn reflexes that you must know. Rooting and sucking reflex, which helps with feeding. Moro or startle reflex, which are sudden movements triggering arms flaring. Grasp reflex, baby holding your finger. Babinski reflex, toes fanning out when foot is stroked. Most disappear by 4 to 6 months except Babinski, which can last till 1 year. Now, in case of newborn diet, breast milk is ideal, every 2 to 3 hours on demand. Formula fed babies eat every 3 to 4 hours and teach parents about burping, signs of hunger, and spitting up as normal unless excessive. You must know the nurse's role for childbearing families. Provide emotional support, teaching, and reassurance. Help establish breastfeeding and bonding. Monitor for postpartum complications in mom and baby. Educate on newborn care, safety, and warning signs, etc. Psychosocial changes in mothers after birth. Many experience baby blues, emotional swings, crying, anxiety in the first 2 weeks. Postpartum depression is more serious, lasts longer, needs medical support. Hormonal changes, fatigue, and body image issues can deeply impact maternal bonding and mental health. Similarly, in cases of neonates after births, lungs begin oxygen exchange. Ductus arteriosus and foramen ovale start to close. Thermoregulation begins, they need warmth. Glucose levels drop, so early feeding is crucial. Now, preterm babies are born before 37 weeks. Watch for immature lungs, poor temperature control, weak suckling, and low immunity. These babies may need NICU care, oxygen support, and special feeding. The maternal risk factors for preterm birth are alarming. Previous preterm births, infections, multiple gestation, smoking, poor nutrition, and low prenatal care are the causes.
Are you ready for another practice question?
The nurse is assessing a newborn with heart rate 110. pink body but blue extremities, crying, flexed limbs, and sneezing. What is the Apgar score? A 6, B 8, C 9, D 10. Now think about it and resume. The correct answer is C 9. Let's break down this Apgar question. The newborn has heart rate of 110. That's above 100, so score 2 for pulse. Pink body but blue extremities, that's acrocyanosis, common in newborns, so appearance is 1. Crying is strong and respirations, so respirations score is 2. And flexed limbs, good muscle tone and activity is 2. And sneezing, that's a strong reflex, so grimace scores 2. Add it up, 2 plus 1 plus 2 plus 2 plus 2 is equal to 9. So the correct answer is C. Apgar score is 9. This baby is doing well and just needs routine post-birth care.
Okay, so that was a deep dive, right? But trust me, these are some questions you will obviously notice in your exam. They test how well you know child growth, how well you know maternal conditions, how well you know the wellness education. So yeah, you need to brush up all these things before going to the exam, right? Keep revising these charts, especially the milestone goals and the immunization schedule. Yes, that is very, very important. And you all know that immunization schedule is different in every other countries based on the vaccinations that are being provided. So you need to brush up how immunization works in the United States since you're giving the exam for the United States. Now, as per ritual, I have another challenge question for you guys for this episode so that you can answer it and comment it and then get featured on my next episode.
So, are you ready for the challenge question of the day? You know the drill. If you are 100% sure about your answer, just comment below and get featured in my next episode. Here's the question for you. A nurse is caring for a newborn immediately after birth. The baby is limp, has a heart rate of 50 beats per minute, and is not breathing. What is the nurse's priority action? A. Administer oxygen via nasal cannula. B. Dry and stimulate the newborn. C. Begin positive pressure ventilation (PPV). D. Perform chest compressions. Now I know it's a little bit difficult, but it's a realistic NCLEX style question based on newborn care and priority nursing actions, a type often seen on the exam. So think about it wisely and comment below and wait for my answer with explanation in the next episode.
In our next episode, we are going into psychosocial integrity. Think mental health, coping, abuse recognition, and therapeutic communication. Trust me, you won't want to miss it. Until next time, stay curious, stay consistent, stay dedicated, and believe in your journey. You've got this.